Hello students, today we will demonstrate how to do granny knot. It is different from the traditional reef knot. In granny knot, it is easier to place, easier to do or easier to execute, but not as secure as the reef knot. Here, after putting the tissue bites, put the knot first throw like this we do, second throw always from front, third throw from front, so that one loop crosses like this, whereas in reef knot it will be like this, whereas this is here it will be like this. So in granny knot, so it clips well, but not as secure as the reef knot. So I will demonstrate how to do granny knot, GRANNY So I will be demonstrating the granny knot, GRANNY, granny knot, KNOT. So it differs from the reef knot that your second throw is taken from front, third throw is from the front. So that is how exactly you will do. So hold the instrument, needle holder, all of you know, then ring finger and thumb, then take a loop like this. Take a loop, see, like this. First throw is same like this, but second throw is not like this, from front. Third throw also from front. So it is clip knot or something like clip knot, but not reef knot. But it is easier to place, it clips well, but knot security is not as good as reef knot. But in the surface knotting it can be used very well. In the depth where you need a proper apposition, like in bowel and other places, vessels, you better to have a reef knot. So it is easier to place. I will repeat again. Hold it like this, hold, square it, then from front, second one, like this. See that here the loop is from different place. This will show correctly. If you look at this part, you will be able to see whether it is reef or granny knot. How configuration in this area, you will be able to make out whether it's a reef or granny knot. So this is the granny knot, front, whereas reef knot is front, back, front. So that is the typical granny knot how to place. So front, unlike reef knot, easier to place, but not as secure as the reef knot. So students, I hope you have understood how to make granny knot, first throw, second throw, third throw, front. Thank you very much.